नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभम करिष्यामि. Hari Om. Yes, yesterday we saw commonly seen sports injuries related to hip joint. The few of them were groin muscle strain, lateral hip pain, hip pointer, injury to lateral cutaneous nerve of thigh, hip dislocation, and pain around pubic symphysis due to overuse, due to stress fracture, etc. These are all common clinical conditions seen in day-to-day clinical practice, clinical sports injury related clinical practice. Now, in your lifetime, you will definitely come across all these type of clinical uh, problems mainly. Now, there are some commonly seen hip issues in general Ayurvedic practice, which are very important to diagnose. And if you diagnose it properly, then it is very simple to treat, or the line of treatment or the protocol of the treatment is very simple after your correct diagnosis. So, let us start with these common hip issues. Transient synovitis hip, pyogenic hip, it is very common. So remember, dear friends, if a patient with limping comes to you with hip pain, he tells you about hip pain, then please investigate it thoroughly for pyogenic hip, then rheumatoid arthritis, osteoarthritis, or the most important, tubercular or arthritis. Perthes is a very common disease seen in mainly small children. I have treated 3-4 cases of Perthes disease also. Avascular necrosis of head of femur, it is also a very, very common problem. Maybe because of overuse of steroids, maybe because of alcohol consumption, or say nicotine or cigarette smoking, etc., etc. And snapping hip. These are some commonly seen hip issues in general practice. So let us talk more about this transient synovitis, or the simpler name is traumatic synovitis. It is also known as irritable hip. You must have heard about this. Many a times patient comes to you with lots of files in his hand, say of orthopedic surgeon or neurologist and whatnot. So the transient arthritis or synovitis of childhood is very short-lived affection of hip. The pathology is unknown in transient synovitis hip, but the main feature, main symptom is pain, then limping, and the third important is limitation of hip movements. So you have to be careful in examining these condition. I'll tell you more about clinical tests related to examination. It is in children under 10, especially boys, are affected in this case, and they tell you about pain in groin and thigh region, and limping is one of the main symptom in this. Limitation of hip movements are there, and there is no alteration regarding x-rays. So this is absolutely a clinical test diagnosis. In earlier stage of, say, tubercular arthritis or Perthes, uh, it may resemble like tubercular arthritis, but it recovers on its own, and after say bed rest or something, people may recover from this. In case of say tubercular arthritis or say Perthes, it won't get reduced with rest. So full recovery is possible in a few weeks in say transient synovitis hip. The another one, this is very important. This is pyogenic arthritis. It is very uncommon, but I have seen a case. It is not my case. I have seen it in an orthopedic OPD of an orthopedic surgeon. Mainly, it is in children, and maybe it is secondary to osteomyelitis of say upper half of femur. In say pyogenic arthritis and tubercular arthritis, these are two different things. Both the features are different in both the cases. So in pyogenic arthritis, mainly it is acute joint infection of say rapid development. Maybe it is maybe patient comes to you with subacute or even chronic pain. When pus is formed within the joint, it is also named as suppurative arthritis or suppurative arthritis. Maybe say staphylococcus or streptococcus are responsible in these cases, mainly in these cases. Say there are the organisms have 2-3 routes. First is through bloodstream hematogenous infection. Then the second is through penetrating wound, and third is by extension from nearby focus of say osteomyelitis, especially when infected metaphysis is partly or full within the joint cavity is involved. So you have basically one has to take care of these cases. Infection causes acute or subacute inflammatory reaction in joint tissues. There is exudation of fluid within the joint. That fluid is turbid, purulent, according to the intensity or severity of the infection. But many a times it resolves completely, and patient does his normal functions afterwards. If we miss this type of diagnosis, if we spoil these type of cases, then total destruction of joint can be found, and it turns out to say bony ankylosis. In case of say acute or subacute with pain and swelling of the joint, illness, weakness, pyrexia are one of the major features. In case of pyrexia of unknown origin, Please find out the focus of pyogenic arthritis also. On examination, the joint is swollen with fluid effusion with partly thickening of synovial membrane. When affected joint is superficial, overlying skin is warmer than normal and it is often red and somewhat hot. All movements are restricted. Uh, these are some important features, some important clinical features. If you attempt or you force the movements, that may increase the pain. Primary focus of infection is often found elsewhere in the body. In these type of cases, in this type of pyogenic hip, you can see the radiograph of these. In these cases, severity of the infection is the major thing, and that is related to prognosis of the disease. In this particular case, this is say old pyogenic arthritis of say left hip of this infant, we can say. The epiphysis of head of femur, it is completely destroyed and hip is dislocated. See, acetabular roof, I think you can see the arrow or the mouse. This will help to distinguish this from congenital dislocation. And to right, we can see a normal hip. This is normal hip of infant. There is this ball is missing in this particular case. So pyogenic arthritis is very commonly seen in many children. In this particular diagram, you can see bony ankylosis of hip, and of course the cause is pyogenic arthritis. Infection spread to hip from focus of osteomyelitis in upper metaphysis of femur. Commonly seen in pyogenic arthritis in say kids above age of say 12, 13, 15, 18, etc. So you can see this complete bony ankylosis of hip, and the bone of femur bone becomes absolutely spongy. In case of rheumatoid arthritis, it is commonly seen. In long-standing rheumatoid arthritis, always elbow and hip gets affected, in which you have to do both the treatments, first local treatment and second one systemic treatment for those which are causative factor of the disease, and local treatment for the dhatu which are involved in that particular disease. This is established rheumatoid arthritis of hip, say destruction of cartilage space, you can say. There is similar cartilage destruction at every space. If it is asymmetrical cartilage destruction, then that is osteoarthritis. If it is symmetrical cartilage destruction, everywhere the gap found is at same is equidistant, then it is rheumatoid arthritis. That is the basic cardinal sign of rheumatoid arthritis, and you can easily diagnose it with the help of X-ray only. The marginal osteophytes indicate that osteoarthritis is superimposed upon old rheumatoid arthritis. The left hip, you can see this is left hip. In this particular case, there is, say, marked encroachment of femoral head into softened acetabulum. So ये फीमर acetabulum में घुस ही गया है. It is also seen in case of rheumatoid arthritis. मराठी में हम इसे बोलते हैं सांधा खचला. This type of X-ray you can see in rheumatoid arthritis of, say, hip joint. In case of rheumatoid arthritis hip, the disability is very severe. So be very much cautious in these type of cases. The changes of, say, the arthritic changes may affect both the hip along with other joints also. That is the main thing. But the main symptom is pain, limitation of movement, which aggravates by activity. Pain aggravates by aggressive activity. So whenever you examine these type of cases, swelling is not that obvious because this joint is deeply situated. This is not a superficial joint, and because of the same thing, temperature of overlying skin is not increased as it is in rheumatoid affection of other joints. So remember this important thing. You cannot palpate this. You cannot have the you cannot see the swelling along with redness, along with increased temperature in case of hip joint rheumatoid arthritis. Because it is a deeply situated joint. Superficial joints like, say, elbow, wrist, ankle, even in case of knee joint, you can easily palpate it. Redness and hot joint, you can easily palpate with your fingers only. In many cases, fixed flexion deformity may develop. Right now also we are doing one case of rheumatoid arthritis. All other joints are normal. There is no active body. Hello.
Yes, sir. Sorry for the disturbance. Please continue.
Okay. My voice is clear and audible. Is there any disturbance?
Yes. No, sir. No, sir. It is clear.
Okay. Thank you. In these cases of, say, a long-standing rheumatoid arthritis which affects hip, In these cases, fixed flexion deformity may develop. And the another most important sign is gluteus muscles and thigh muscles are wasted. So it is very important. In case of the investigations, ESR plus CRP plus high sensitivity CRHS CRP is to be seen, and it is increased during active stage, Vegavastha and Avegavastha. The treatment will be different for Vegavastha and Avegavastha. In case of Shwas also, whenever we are treating Shwas patient, in case of Vegavastha, the treatment will be different. In case of Avegavastha, the treatment will be different and will be, first it will be Pachan, but afterwards it will be Dhatu Poshak treatment. In case of rheumatoid arthritis also, in case of Vegavastha, in case of acute pain along with restriction of joint, along with swelling with high temperature of that particular joint, the treatment will be different. If you have to give Agnivardhan Dravya first, then accordingly you have to change the treatment. In case of Avegavastha, the Avegavastha of say rheumatoid arthritis, the treatment will be totally different. The treatment will be of say joint stability to strengthen the joint, Rakta Prasadak treatment, and other Rasayan Chikitsa, which will help reduce Vat, which will help increase in the say other dhatu, other dhatus. That's it. So whenever you are treating rheumatoid arthritis, please remember which avastha you are treating right now. Whether it is Vegavastha, Avegavastha, Samavastha, Pachamanavastha, Pakvavastha, Jirnavastha, dosh or dhatugata or koshtagata or marmasthi sandhigata, that all you have to understand thoroughly and then you have to treat it accordingly. So rheumatoid arthritis is bread and butter for us. So you should be able to treat hip rheumatoid arthritis also. In case, see, it is chronic non-bacterial but inflammatory disease of a joint. It is often associated with other symptoms like pyrexia, general debility, and it affects several joints at the same time, more than three or more than three joints. That is polyarticular arthritis, it is known as. And joint changes of a similar nature, it also occur in a number of other conditions also. Like say Reiter's syndrome or psoriatic arthritis, etc. In case of say lupus erythematosus also, systemic lupus erythematosus, SLE. In case of that also, you may find this type of diagnosis. This is a purely autoimmune disease. Maybe there is one theory related to infection, so it may be possible because of infection also. But autoimmune disease is commonly seen, is commonly heard for say rheumatoid arthritis. So this is the say Amavat or Vatarakta. According to clinical condition, you can diagnose it as Amavat or say Vatarakta. Many a times it is Amavad, but few times in case of say 20-30% also, we may found it as Vatarakta. So I will not go into details of is it Amvad or Vatarakta or something like that. But Avasthanurup Chikitsa is very important. Name is not that way very important in these type of cases. Patient is usually young or middle aged in case of rheumatoid arthritis. More often it is a woman than a man. Always remember, rheumatoid arthritis, in case of polyarticular arthritis, in case of more than 3 or 3 plus joints are affected, in case of affected joints, along with the affected joints, there is swelling, restriction of movement to the joint, along with say fever, general debility, constipation, etc. So remember, my dear friends, you have to diagnose it. If a middle-aged female comes to you, if a 45-year female comes to you, then immediately diagnose it as rheumatoid arthritis. Mainly it is rheumatoid arthritis only. Any joint may be affected, but moreover, it is peripheral joints are affected in case of rheumatoid arthritis. Say, first, hand or wrist related joints, then feet, knees, elbows. It is very common that hip is involved, but whenever hip is involved, it is always a difficult case. If a patient of known case of rheumatoid arthritis or a patient gives you history of rheumatoid arthritis, then beware. And if it is hip is involved, then you have to be somewhat careful. If shoulder is involved, you have to be careful because it may be irreversible. So remember this. Onset is very gradual with increasing pain, swelling of one particular or two joints at a time. Pain and stiffness gets worsened when you start doing some activity, and it is always related to winter season also, and in case of rainy season also it increases like anything. Tiredness, anemia are some particular features related to it. So we have to be careful in case of these patients. Say, whenever we start examining rheumatoid arthritis cases, the affected joints are swollen because of synovial thickening. Today also we have seen a case of chronic rheumatoid arthritis. Now all the joints are clear. Now she can walk easily. She is having a good appetite, no constipation, and there is no problem in case of rheumatoid arthritis. But the only one joint, that is left knee, is affected. It is red, hot, and restriction of movement is there. So it is a reactive synovitis, we can say, and it is because of rheumatoid arthritis only. Range of the joint movements are restricted in this case. Movement causes pain. See, in case of seropositive disease, say rheumatoid factor is absent in case of seronegative cases. The restriction of joint movement is more. So whatever the case is, seronegative or seropositive, you have to treat it according to Ayurveda only. And Ayurveda has great success in case of these type of cases. See, destruction of ligament and bone may sometimes lead to subluxation, and that is important. So remember these things also. In case of, say, imagine you have seen all these things. In case of, say, rheumatoid arthritis, every time blood reports are highly suggestive. When we will be talking on, say, rheumatology, we will definitely come across a blood test, basic blood tests, and special blood test related to rheumatoid arthritis. So we should understand why these tests to be done. In my OPD, I always tell a rheumatoid arthritis patient to do at least CBC every after 45 days. It is very important. CBC will give you insight for the specific treatment of rheumatoid arthritis. Remember this. These are the only things related to, say, rheumatoid arthritis. In case of, say, a patient comes to you with rheumatoid arthritis, always remember we have to first go for dosha pachan, and we have to prevent further destruction of dhatu. You have to save that particular joint. That is very much important. Treatment, all we know about the treatment of rheumatoid arthritis, that is Langanam, Swedanam, Tiktadipanani, Katunicha, Virechanam, Snehapanam, Vastayacha, Amamarute. See, after doing Virechan, after the vitiated vad gets anuloman, gets into original form, then there are Rikta Srotas, which are because of Sangha, which got vitiated. The Srotas gets Rikta or gets empty because Vat gets its own path, its own direction, etc. So, in this particular case, after there is a Rikta Srotas, you have to fill it with the help of, say, Anuvasan Basti, Abhyanga, Angamarda, Niruha, etc. Nirama Vata Chikitsa. Afterwards, you have to do this because this is very important. Nirama Vata Chikitsa. Very important disease. You can see this tubercular arthritis, say, loss of joint cartilage also you can see, and early erosion of bone surfaces are there. See, on your right side, you can see the normal bone also, and this is affected bone. Loss of joint cartilage, early erosion of bony surface. You can see this in case of, say, tubercular arthritis. So, in this early stage of, say, tubercular arthritis, uh, cartilage space is somewhat reduced, but the the joint is intact. See, this is advanced stage. Now, on your right, you can see this. You can see this case. The cartilage is destroyed, and articular surfaces of bones have lost their sharp definition. Joint is permanently damaged, permanently destroyed, permanently spoiled. Now you cannot do anything with this particular joint. These are irreversible changes in your joint. So it is always always remember about tuberculosis of hip. Mainly in our country, the children of say up to say 5 years or 6 years get these type of infections, and there is often history of contact with a person with active pulmonary tuberculosis. Pain and limp are the main important features in this case. If a kid of say 5-6 years comes to you with severe pain in hip joint, then please remember you have to thoroughly investigate this type of cases. Weight loss, fever, general debility are the other systemic causes in these type of cases. If you go for forced movements, then patient gets too much pain and muscle strain may patient get. So this is related to tuberculous arthritis, and you have to differentiate it with Perthes disease, that is also known as, the normal name is osteochondritis. See, many a times low-grade pyogenic arthritis, that is pyrexia with somewhat fever, is seen. History is very much important in case of say tuberculosis. Cold abscess is another important characteristic that that is shown by a radiograph or by X-ray. So you can correlate with say ESR, and that's it. CRP. These are two important points to be understood. See, in case of osteoarthritis, this is a very common clinical condition. Again, in case of hip joint, it is not that common. Commonest joint to be affected as osteoarthritis is knee joint. That is very important. Now, in this case, osteoarthritis is having severe disability, especially in elderly people. It is not that way uncommon in younger patients also. Nowadays, we can see them. We can see osteoarthritic joint. So, whenever a patient of osteoarthritis comes to you, osteoarthritis of a single joint or say a group of joints, a patient comes to you, then if this type of patient comes to you, then remember you have to take care first. many a times the symptoms are kapha pittaj, then it turns to be pitta vataj, and then vataj. So nutanavastha, then subacute, then chronic, atyayik avastha. These are different avastha written by our acharya. So in this particular osteoarthritis of hip, narrowing of cartilage space, you can see sclerosis of subchondral bone and osteophytes at the joint margin is seen in these type of cases. In advanced osteoarthritis, it is completely purely vataj in nature. In advanced right hip osteoarthritis, common feature that causes shortening of limb from tilting of pelvis. Okay, so the important features are narrowing of joint space, subchondral bone sclerosis, and marginal osteophytes. So, in case of say advanced stage osteoarthritis, think like Shuddha Vat Chikitsa, because after chronicity, Vat gets vitiated and it starts ruining this complete joint. Perthes, it is another important disease. Perthes, I have seen Perthes disease. You may also have seen these type of diseases. So basically, blood supply of head of femur gets hampered in these type of cases. So I think you should see this particular diagram. In this case, it has a unipolar blood supply. Remember, my dear friends, the main three sources are there of say blood. Medullary vessels from neck, retinacular vessels entering from lateral side of head, and foveal vessels from ligamentum teres. Most important of these, one mainly see medullary vessel and retinacular vessels gets cut off, then you may get fracture of neck of femur, and sometimes it may result into a vascular necrosis of femur. So remember one thing: if medullary vessel and retinacular vessels get cut off, then there are two necks. Main is surgical neck, and above that there is transcervical line. If it breaks, then it is difficult to recover. So in case of this type of injury, avascular necrosis of head may occur at any point of time. First, I was not that keen in diagnosis, and I told my orthopedic surgeon, sir, that Perthes or say avascular necrosis of head of femur is very common. So he asked me one question: why femur? Why it is not say tibia or fibula? Why only femur gets avascular necrosis of head of femur? So it is only because the main important thing is blood supply. It is unipolar blood supply. If the arteries gets cut because of n number of reasons, then AVN occurs. The most important cause: a patient comes to you above 50 and he gives you history of alcoholism. Remember, he must be having a vascular necrosis. The second most important cause, and which is commonly seen, it is very commonly seen in my Ayurvedic practice, that is overuse of steroid therapy. Then a patient, if he is there on dialysis medicines, then you have to be very much careful in that case. If a patient is on cancer medicines, then also you have to take care, because avascular necrosis of femoral head may occur in these type of cases. See, it is loss of vascularity of a part of bone occurs commonly after a fracture or dislocation. AVN of femur in a fracture of femoral neck. Sometimes part of bone that undergoes avascular necrosis spontaneously. Head of femur is a very common site of this, and it occurs in adults between age of say 20 to 45. I have told you more about the causes of avascular necrosis, that is alcoholism, steroid. If patient is on renal dialysis, or patient is on anti-cancer medicines, then maybe the possibility of risk gets much more than normal. And X-ray is the only treatment in these type of cases. So this is Perthes is seen in small children, and AVN is seen in big children, or say adult one. You can see these type of changes in your body. In this case, femoral head is temporarily softened. So this is also very important. Yes. So again, after say Perthes disease, in case of Perthes, or in case of avascular necrosis, never miss the opportunity to give basti to the patient. So Tiktakshir basti is one of the major important plays important role in this. Snapping hip. It is another clinical condition you must have heard, or you must have seen these cases. Snapping hip. It is a very harmless condition. Distinct snap, click is heard and felt on specific movements of hip. There is no underlying injury, or there is no disease also, but slipping of say tendinous thickening in say gluteus maximus over say bony prominence, that is what we call it as tendon gets slip on bony prominences, and you get snap sound. With relaxed muscle and with say passive movements it won't happen. You have to do active movements and with some somewhat tight muscles. Mm, in this case, pain is severe, so you have to take care accordingly. So these are some important commonly seen hip issues in general practice. There are so many other cases also which are seen in hip joint. All hip joint related pain is not always arthritis only. There are certain other cases also, like say pointer hip, hip pointer, snapping hip, etc. So do take care of all these diagnoses. These are commonly seen diagnoses. Tomorrow we are going to take say clinical tests. These are some clinical tests we will be taking. Plus we will go for say one or two x-rays, how to read x-ray. And the third important point is mainly with the help of Anshansha Kalpana, with the help of Avastha of the disease, how we are going to select Quath, how we are going to select oil and other things that we will discuss tomorrow. So thank you all for being with us on this particular hip related problems. I know hip joint is a very boring joint, so you may not find it interesting, but please be with us. Some joints are not that interesting, but one single patient with correct diagnosis, only a patient with correct diagnosis, that will give you 100% satisfaction, that will give you complete job related satisfaction. So beware, upgrade your knowledge, update your say what we call it terminologies, vocabularies, etc., etc., and try to study well in these joints which are not very well accepted in general practice. Thank you.